Now we're going to hear from our two social workers. Michelle Erford is a licensed clinical social worker who has worked as a neuromuscular medical social worker at Lurie Children's Hospital for the last 3 years. She earned her master's in social work from New York University, and prior to her role at Lurie, she has worked as a drug and alcohol prevention specialist as well as drug and alcohol abuse counselor. She also spent several years working in the field of mentorship with high school youth at Big Brothers and Big Sisters of Chicago. And Anna Goldberger has been a neuromuscular social worker with the Anna and Robert H. Lurie Children's Hospital since 2017. She is bilingual in English and Spanish and brings a strong background in the community of mental health. She uses her skills to help neuromuscular families navigate an often daunting medical system and manage complex medical needs with dignity. So thank you for being here, you guys.
Thank you so much, Nicole, for the introduction. My name is Michelle, and this is my coworker, Anna. We're both at Lurie Children's Hospital in Chicago. And first, just wanted to say a big thanks to MDA for hosting this series. This is definitely a huge topic that's very important, especially for a lot of our families that we see in MDA clinic in Chicago. And we're very grateful to be invited to speak today. I don't know if you want to say anything else.
No, I've been looking forward to this opportunity. It's one of our favorite topics.
All right. There's a little picture of us as well from one of our events that we coordinated for our patients, a spring fling dance for our teens and young adults, which was a lot of fun a couple years ago. So today we just wanted to provide a general overview of topics related to transition, talk a little bit about guardianship, some benefits, insurance, other public benefits, financial assistance, and then a little bit more about what transition looks like for the patient and for the caregiver, and how you as a parent can also be involved. And wanted to quickly mention too, since many of these benefits are federal benefits, are available to anybody throughout the country, but the states have different requirements and eligibility. So wanted to just give that little disclaimer before we begin. Anna and I are obviously very familiar with Illinois, as that's where we work. So we are going to do our best to give a good overview of the programs, but just knowing that the way things might work in your state where you live might be a little bit different.
Am I taking that slide?
Sure.
Okay. So just like our first bullet point says, we want to start off by saying that transition is a process, not an event. I think one of the misconceptions can be that transition just refers to the transfer from pediatric medical care to adult medical care. And not only is that can be a very complicated process if done correctly, but there's all kinds of other things we like to make sure families consider. So medical care, obviously, and then like where you're going to get your care, is your insurance compatible? A health plan, which is sort of looking ahead at different decision-making points that might come up for the young person, and then what kind of support they'd like as they move through those things. Education and employment is all a big part of this as well. When we talk about transition, we like to help hear about or help people decide, are they thinking about school, are they thinking about work, and what are they thinking about those things. Housing and transportation are major issues. Sometimes people are finding that their physical needs are increasing as they're getting older, and so people start to talk about, do they need to move? Are there new modifications they need to put in place on the house? And then transportation, of course, is always an issue when you're working with when you have limited mobility. And a big one is autonomy in personal life. We don't ever want, that we get so focused on tasks in medical care in clinic, and we don't want to forget about building a sense of independence and autonomy. A young person having control over and thinking through and having control over how they want their life to look, talking about relationships and dating, how they want their relationships with their caregivers to look, all of that stuff. So it's a big, broad, and rich topic.
Mm-hmm. Yeah, and it's definitely something that we should start very early. I think when I was first learning about transition and the best approaches for that, I was really surprised to hear that most of the recommendations say to start talking to your providers about transition to adult care as early as 12 years old. And that's not to say that you're going to talk at 12 years old about which adult care clinic is next to you and where you're going to go, which doctors you're going to see in the next, 8, 9, 10 years. But this whole process of learning independence, gaining knowledge, having the patient in their early teen years really start to develop advocacy skills for themselves, speaking up, knowing their diagnosis, taking charge of their appointments, taking charge of their care. That can all be started very early on so that you can slowly develop those skills so that when it is time to go branch out and see an adult provider, you feel really prepared. So the next couple of slides are looking a little bit more specifically into some of these different topics that we've mentioned. And I'll let Anna share about guardianship.
Sure. So guardianship and healthcare power of attorney are just, they're just one option or one set of options to consider. A lot of neuromuscular patients don't need to even look into these things. So in case you don't know, so guardianship is when you're talking full legal guardianship, it's a process that results in the courts appointing a guardian to make decisions about healthcare and financial questions and personal life on behalf of an adult. And this is only in cases where somebody is really not capable of making those decisions on their own or making them without assistance. So I'm just going to go into this a little bit briefly. There's several different types of guardianship based on an individual's needs. So some of that can be temporary, some of it can be permanent. There are types of guardianship where you don't need to go into court because it's a very temporary situation. You just need to have the right forms and sign them and witness them. And then there's full guardianship where a caregiver is going to petition the courts to request full guardianship of somebody who is really struggling to make those decisions on their own. Usually they're having difficulty making those decisions because of cognitive issues. Occasionally we see situations where someone's physical disabilities are limited enough that they would just prefer that their caregiver make those decisions for them. But I want to say, and this is why it's in all caps, full guardianship is an absolute last resort. Used in situations where it's 100% clear that this person is going to need that type of assistance, because it takes decision-making rights away from the patient, from a young person. Physicians are asked to fill out forms and things like that. The physician also has to be on board with all of that too. Even in full guardianship, where possible, we'd like to encourage caregivers, guardians, and patients to make decisions as a team, so that even where somebody really does need that kind of assistance, we can provide them with as much information as they would like, and they can make the decision together with whoever is the guardian. But again, we think it's really important that whatever option you choose, if you end up going down a different guardianship scenario, that you choose the least restrictive option and allow for the most autonomy for the person. On an entire different note is the power of attorney. So many of you may be familiar with this already. Power of attorney for healthcare is just a form that's filled out and signed with witnesses stating that the person, the adult, 18 and older, is choosing someone to make decisions about their health care in the case that they are not capable of making those decisions, as in loss of consciousness, intubated and unable to communicate, in those kinds of situations. Or, you can defer anytime you want to your power of attorney, but it's usually only in extreme situations. Everyone should probably have something like that filled out, unless, you're married and you live in a state where where there's automatic laws, like in Illinois, like the surrogate laws that defer to your spouse. So that being said, those forms can be found online and downloaded and signed, and you don't need a notary. You just need to have copies and make sure your doctors have copies of those things. There's also a financial power of attorney, which is a whole separate subject. I know a little bit less about that, and that's done with help of legal representation and is a different process. But I just want to make sure that people know that those options are out there, and that even people who need full guardianship or some form of legal guardianship can also lead full adult lives with support.
So continuing on, going into a little bit more in depth about adult benefits. With insurance, it's definitely something to consider because there's often a lot of changes as you become an adult. So there's three main avenues for getting insurance, which most of you are probably aware of. Health insurance through an employer, health insurance through the state, which would be like a Medicaid or Medicare plan, and then health insurance that you just purchase from a private company, and most often that's through the marketplace. So if you are currently covered under a health insurance plan from your parents, you are able to actually stay on that health insurance plan until you're 26 years old. So if that is something that you have access to, that is a great way to not have any disruptions with insurance care coverage, anything like that until you're 26. For state-run programs like Medicaid, that's where things get a little bit different. So like I mentioned earlier, eligibility and coverage and processes definitely vary by state when it comes to Medicaid. But it's always a good idea to reach out before you turn 18 to learn that process and what you will need to do to maintain your coverage once you become an adult. Because we definitely don't want anyone to have any disruption in care that would result in not being able to get your medications or having huge, bills because of a doctor's appointment or an emergency visit or anything like that. Just for example, in Illinois, children are eligible for Medicaid until age 19. And then once they turn 19, they have to resubmit an application for adult Medicaid, just because it's a different set of eligibility and financial requirements. Typically, if you're eligible for Medicaid and receiving it as a child, you should be as an adult as well. And the other thing to note is that in most cases, as an adult, if you're applying for Medicaid and your parents are still claiming you as a dependent, then your parents' income will still count towards the financial eligibility for Medicaid. And then just a few notes about purchasing a plan. Generally, they're a lot more expensive, although we know that sometimes that's the only option for some of our families. So considering cost and also making sure that whatever plan you're getting is going to match with the adult medical care that you want to receive. So if you have an MDA adult center in mind, making sure that you check with them and whatever plan you're choosing is going to be accepted there, so that, again, there's no gaps in coverage, there's no gaps in receiving any of that care. All right, thanks. Yeah, no worries.
I would like to touch on another benefit that becomes, at least in Illinois, personal care attendants, personal care assistants, or personal attendant. There's a lot of different ways to talk about it. But in Illinois, we've found that once you turn 18, you're often eligible for a lot more of these benefits. So something to keep in mind. I'm not sure what everybody's situation is in the different states they're in, but it's always worth reapplying if there's something you applied for and didn't get. So PCA benefits are funding often through your state Department of Human Services for someone to assist with activities of daily living. And that's some of those basics like getting out of bed, cooking meals, grocery shopping. Sometimes it's homemaker help, as in cleaning up and tidying up around the house. again, like I said, usually the state approves a certain number of hours, and then the family or individual hires someone of their choosing to act as the personal care attendant. So often that, for a lot of families, the preference is that it be a family member or a friend, someone they're familiar with and that they trust. But there are certainly situations where that's not possible, where someone like that isn't available, and you can work with an agency to help you find someone. And that involves screening and interviewing, but it's definitely doable, and lots of people do it. Then, you know, and again, like, you know, everybody, it's going to work a little bit differently for every family, right? So some people have felt that we've learned over the years that having their parent and primary caregiver be their PCA is a great fit and works well and is an extra source of income into the home, which is often really needed. And then for other people, having your parent be your PCA ends up feeling like you've lost a little bit of independence, whereas having a separate, like a friend or family member that doesn't live in the home, or even someone through an agency be your PCA, gives you a certain amount of autonomy and separation that may be really needed at that point. You know, the best way to look into this is just check in with your state's Department of Health or Rehab Services or Department for Disability Services on how to apply for those. We assist people with that on a regular basis. So if you have a social worker with your care team, that's someone, those folks often know exactly how to handle those things. So.
All right. Moving on to SSI, Supplemental Security Income. This is a very complicated system, and so I'm going to do my best to cover a lot of information about this, but I will always defer to organizations and attorneys that deal with these benefits on a more regular and thorough basis, because like I said, there's a lot of ins and outs with eligibility and criteria and all of that. That can be very complicated. So yeah, a note on that. So supplemental security income is different than Social Security. So this is financial assistance through the government, and it does not require that you have worked before. So supplemental security is also available for children and adults with disabilities, but it's always based on financial need. So you need those two components. You have to have a qualifying disability or diagnosis and demonstrate financial need. If you are receiving SSI and you're under 18, your benefits and standards eligibility will still change. And so it's definitely same with insurance. It's always good to check in when you're turning 18 to see what those changes might be and what you might need to do to maintain benefits. Let's see. So you can still, even if you're getting SSI as an adult, but you want to pursue employment, you can still work and continue to maintain those benefits. There's a lot of nitty gritty, criteria for this, but any income that you have earned from an employer, SSI will deduct any expenses that you have related to your disability. So things like the cost of medications or different, maybe specialized housing, PCA hours, if you're supplementing some, if you're paying somebody else beyond hours that you might be able to receive. So any of that would be deducted from your income so that the income level that SSI looks at would still be lower. That's a little complicated. I'm going to try to make it a little bit more simple. So just say you're earning $500 a week, but you pay $100 a week for your medication. So in the eyes of SSI, you'd only be earning $400 a week. So they have a lot of these requirements that make it so that if you want to still work, you can, and you won't be denied these extra financial benefits that you should still be eligible for. SSA.gov is the website for Social Security, and they don't have an online application for benefits if you're under 18, but if you are 18 and over, you can apply online and begin the process all online. So that is very helpful. And as I mentioned earlier, definitely check out organizations or attorneys. Look for attorneys that specialize in public benefits, and they can assist with an application. Oftentimes too, we see that people are denied the first time that they apply, and it was because some form was missing or something wasn't checked on this other form that you didn't claim. All these little, minute details. And there is an appeals process, and attorneys can be very helpful walking you through those appeal processes and all of that too. So, yeah. All right. Anything else you want to say about SSI?
No, I just want to say before I forget, I did see the question in the chat about how old a patient needs to be before a parent can become a PCA, and it is 18 years old. And prior to 18, you're going to need to have someone who's not the parent be a PCA. So, thanks for asking.
Yeah. Ableaccounts is another benefit that is for anybody, individuals with disabilities, not just adults. But this account, it differs from a special needs trust or other accounts designated for individuals with disabilities. It does offer tax advantages. So some of the features of the Ableaccounts is that any income that you make from this account is not taxable. And the amount in an Ableaccount is not counted when you're looking at other benefits that have financial eligibility components. So Medicaid, SSI, things like that. Any money that would be in an Ableaccount would not be included as an asset or income for you when looking at those programs. So that's really helpful if you are eligible for these other programs. Funds from an Ableaccount can be accessed at any time, and it can be used for anything that improves the health, independence, and quality of life of the individual. So that is a very broad definition, and you can use it for education, housing, transportation, like I said, anything that would help improve quality of life, independence, and health. So it's a very flexible option for how to use these funds. Each state, so not every state has the option for an Ableaccount. There's several states that manage their own Ableaccount programs, but the good news is it doesn't really matter where you live, because you can open an Ableaccount in whatever state that you are in. And so this nrc.org website, it has a ton of helpful information. It details all the states that have this program and can guide you on how to set one up.
Okay, so we're going to shift from some of the concrete details into a more sort of general. This is one of my favorite areas to talk about. It's about development of the young person, development of the family alongside them, and as you can see, its title is Parents' Role in the Transition to Adulthood. So, it's going to be different for every family, and based on the needs of the individual, based on the needs of the caregivers. We love to see when families can figure out in the way that works best for them how to foster independence in their young person. And so, like we said at the beginning, like Michelle said, starting early on transition is a way to help your young person become more and more independent with their health care. So involving your child in their medical care early, keeping these conversations open, helping them understand what different medications are for, and what different treatments are for, all of those things can be really helpful. And along the way, we think it's really helpful for families to sit down and have conversations about independence, plans for the future, different types of decision-making, and finding out what everyone has in mind, what they envision, what that's going to look like. Like what does your 14-year-old think about life after 18, life after high school? what are their visions for their future? And then how are they thinking, you know, as you move closer and closer to 18, how are you thinking about making decisions? Is this going to be something you want to do completely on your own? Are you going to continue to involve your parents? And it's going to look however you need it to look. But it's really helpful to just have these open conversations in an ongoing way. We urge you to use your care team as a resource. For our care team at Lurie Children's, social work, child life specialists, and palliative care folks, as well as the specialists, our neurologists and pulmonologists, can be really helpful in talking about what independence can look like, and have different types of conversations that are developmentally appropriate about what the future can be. We don't want to see people limit their imagination around these things because of a disability, because of just a fear of what's out there. There's so many different ways to make it work for you. We encourage parents to have their kids speak up during appointments, and that means especially the more and more comfortable they get talking about their illnesses and asking questions. We also like to have the rest of the care team direct questions at the child, at the patient, and parents can ask for this. They can clue the team in that that's how they want things to go. The other thing that we think is really helpful in fostering independence, for those of you that don't know, MDA camp and any other activities that a young person can participate in, whether their caregivers are around or not. I mean, one of the reasons we emphasize MDA camp is not just because this is an MDA presentation, but also because everyone we talk to that goes to MDA camp, parents and young people alike, report an increased level of confidence and independence. And part of that is just getting practice asking for help from people that aren't your regular caregivers. That's part of learning how to be an independent adult who needs support. And that's true of all levels of functioning and ability. So it's you know, one of our parents says, you know, what did she say? When Erica comes home from camp, it's a different Erica. And she meant it in a positive way. This was a parent who was glowing as she said this. I replaced the name, but so, and another really great option too is MyChart or online charting and communication with care teams. That's a nice way to teach a young person to sit down and log in, create their own login information, and be able to look at their chart and ask their providers questions electronically. It's like a safe way. A lot of times, understandably, there's people that are uncomfortable calling and using the phone. I have my own days where I don't want to talk to people on the phone. And so MyChart is a great workaround for that. And I would imagine a lot of folks listening to this have many positive experiences with fostering independence and have learned a lot and would have a lot to teach us on that as well.
Yeah. All right. So this brings us to the last slide. We just wanted to throw a couple resources up that help talk a little bit about some of the topics we brought up today. So MDA has a wonderful resources page on their website. They also have a whole section dedicated to young adults and transition and all the topics related to that. So that's always a good place to start. The National Council on Disabilities. So this is an independent federal agency that is tasked with advising the President and Congress on policies, programs, practices, anything related to individuals with disabilities. So there is a lot on their website, but they also have a fairly comprehensive resources list as well that talks about insurance, housing, public benefits, independent living, all sorts of resources. Centers for Independent Living are also a really great place to start if you're looking for more concrete help with employment or any disability rights issues. If you have run into discrimination or other things, a lot of the CILs can handle that and help advocate for you. And some CILs will also have housing programs and other things to help with benefits. So ncil.org, there is an office locator on that website, so you can see which office is closest to you. Got Transition is also a federally funded website that's like a resource hub for anything transition to adult care. There's quizzes for caregivers, quizzes for patients, a ton of information. That's always a good one to look at. And then SSI.gov, I already mentioned that as well. Anything else?
On that, no. I mean, the other thing I neglected to mention, I just want to put a plug in on this, is the Americans with Disability Act. We are all aware of it. When people are looking into employment, I think there's a lot of potential employers that don't know anything about the ADA, or they know something and are hoping that the applicant doesn't. You have rights, and it's really good to get familiar with those. And so there's a lot of different cities and states that have local disability advocacy organizations. I think Centers for Independent Living, as you mentioned, is a good place for that. National Council on Disability. And then the other piece of that, then, if it's college or further education that you're looking into, as opposed to employment right away, it's a really good idea not only to be a little bit familiar with your rights under the ADA, but also to get in touch with your Office of Disability Services at whatever campus, even if it's virtual. So there should be some kind of, whether it's through their diverse student office or they have a whole separate position or office for students with disabilities, there should be some kind of liaison through the school that knows how the school handles disability issues, and advocate for yourself, for your child's needs. You deserve to be getting the same education as everybody else, and they they are obligated to accommodate. So I just wanted to make sure we say that. Okay, you had a question in the chat. Did you see that?
Thank you, you guys. Yeah, I just wanted to bring up, someone wanted to know, can you please repeat what you said about if you're 19 and SSI and not being claimed on taxes?
Yeah, so my understanding is that for SSI benefits, the individual can still be claimed as a dependent on the caregiver's tax forms. It's for Medicaid where I think it gets a little bit tricky, because when Medicaid is looking for financial eligibility, if the individual is claimed on somebody else's taxes as a dependent, that dependent's income is also going to count, which I don't think is the same for SSI, but we can double check on that.
Okay. It's hard when you're trying to talk global or, nationwide with all these different rules. I have to say too, we have a speaker coming up next who's from Got Transition, and then also Mark Fisher from MDA. He's also going to talk about, becoming more of an advocate for yourself. So those are two things that you guys, spoke about, and I think are important for this group to hear. I don't see anything else that has popped up. I know if something comes up later, I will shoot you guys an email, but thank you very much for being here today. Oh, wait, we did get something.
There's a Q&A.
Yeah, my son is 20 on Medicaid and is claimed by us. He gets SSI and Medicaid in Illinois.
Oh, wow. That is wonderful.
Yeah, great. We're glad.
It's also possible that even if Medicaid is counting parents' income, that you would still qualify. So it's not like a hard no that you wouldn't be eligible. It's just that oftentimes they're looking at other income sources, but that doesn't mean that you still wouldn't qualify. But definitely good to know. Thank you. Like Anna said, I'm sure everybody on here can share so much information for all of us too. So.
All right. Well, thank you guys very much for your presentation today.
Thank you so much.
Thanks, everybody.